I think we should be live soon.
I think it is.
No, I didn't see it yet. Okay, I think we are now. Okay, good afternoon, everyone. This is December 17th, Friday, United Medical ACU, Delaware Health and Community Updates. This is our regular updates, and I have Sean Diamond with me. Hey, Sean, how are you doing?
Doing well, thank you. How about yourself?
Good. So we are going to cover different topics today, mainly on the COVID updates, and then we have, let's see what we have. So we are going to discuss anxiety and depression with Donna Gunkel and Dr. Carlo Valencia. And there are some healthcare related updates. As much as we have time, we are going to discuss those. So, well, we start with our cartoon of the week. So, Sean, this is yours.
Sure. Yeah. So our new feature here is kind of our political cartoon related to healthcare. So this one here we have featured from U.S. News. It's kind of the gist behind this is the blame game, whereas, we have the citizens in the lower left are saying, the economy is tanking, they're blaming President Biden, and you have him tossing the blame off to the virus. And then, of course, the virus saying, being that people aren't being vaccinated, that's why it's still around and looming. So it's kind of just this idea that no one's really taking acceptance and they just want to pass it off.
All right, so now let's start with our COVID updates, and then we can introduce our guest for today.
Yeah, definitely. So we have our global statistics here. We pointed out last week, the United States was around 122,000. So we are slightly lower, down to 121,000 with our new cases. As we kind of were expecting this the past few weeks. We mentioned as we're getting closer to the holidays and the winter approaching, we were kind of expecting an increase in cases. Also, obviously, with the Omicron variant now becoming more prominent, along with the Delta and the original, we're expecting these cases to rise. So again, here we have another visual of the uptrend as we approach this winter here at the end of mid to end of December. At the right hand end of that graph, you'll see it's going up. And again, our global, we still mentioned the US is not part of that 15, but overall, all of these top 15 countries with their vaccinations are slowly creeping towards that threshold at the right end. That I think Cuba maybe was like 2 or 3 weeks ago they surpassed it, but so far it's just them as a sole member.
We didn't make the list yet.
No, still not yet. And then here is our United States vaccinations. So we are up to 488 million. So far it was 475 million, I should say, last week. So 74.4% of the country's population. And then if you see the graph below as a visual, we do have that steady uptrend as we approach, again, end of December here. And we're looking down at the bottom with the average weekly, during the last week report, averaged around 1.3 million administered vaccines. So
this is the entire United States with just the summary of 202 million people fully vaccinated, right?
That's fully vaccinated. The chart there in the middle of the screen is at least one dose, breaking it down by the age. And then also you see on the left-hand side, we also have over 56 million now have the booster dose. Yep.
So what's surprising is the Delaware. So like, again, we want, as we are the healthcare providers, you would like to see Delaware being one of the examples for all the good stuff, not the bad. So the vaccination is, it's about the average, right? So we actually have seen this even with the testing during the process that we were getting in the beginning of the COVID. So the number of tests that we have done, that was not actually enough, or we were we are always below the US average. So, but still we have about 554,000 people who are fully vaccinated. So from that, let's see,
yeah, so
this
the
is the
554 was last week. Yep. So actually we're up over,
yeah.
over 560 now, which obviously that number is from the 16th. So could be a little bit even higher now. And then also we just included down there, it was kind of a breakdown by age group with their one dose fully vaccinated and also receiving the boosters.
So in 1 week, is it fair to say that in 1 week we have only 6,000 people got vaccinated, fully vaccinated?
Yep, just about that amount. Yep.
Yeah, that's a low number, right? So we are hoping that we can actually increase this number. Now, so Sean, I was in New York City last weekend. So you're from New York, but you're not from the city.
I'm about 45 minutes north of the city, so it's still suburbs, but not too far off now.
What happened? What's really interesting, actually, what's happening in New York, and I don't know if it's happening in other places as well. So, you know, when you go to a restaurant, you don't actually need to show your vaccination. Mm-hmm. But when you go to a movie theater, we mentioned last week we were one of the sponsors for the New York Turkish Film Festival, and the movie theater, like, in order to get in, you have to be vaccinated. So about an hour before that, we had a brunch and we were at a restaurant, and then a bunch of people were sitting next to us and we don't know who they are. So then no one was vaccinated because no one was asking in the beginning. So then I'm assuming that they're not vaccinated because they didn't ask us. Right. So, and then an hour later, you have to go to a movie theater, and then now you have to be vaccinated, and you have to be putting in the movie theater, you have to keep your mask on. Mm-hmm. So like if there's a different air in the restaurant, like it's pretty hideous process.
It sounds like there should be some sort of standard in place, you know, regardless of what establishment you're in, what's the occasion.
So the interesting part for me was I didn't have my vaccine card. So I panicked for a second, and then I just realized that I have my IQ Health, our patient portal. Yep. And I was able to pull the vaccine document. And then, like we were talking about, like people are talking about COVID passport, this and that. But if you have your IQ Health patient portal, then everything is in your palm, and you are able to actually get through that without any problems. So it was the most probably useful time ever.
There you go. Of course, you know, make the trip, you want it to be worthwhile. But yeah, you said good thing that you do have your IQ Health set up, and then you're able, obviously, electronically spam access right there with your smartphone on the spot.
Yeah. So, well, at this point, like even with let's say even pandemic is over, like it's not, but even if it's over, the telehealth is not going to go anywhere. So for all of our patients, for them to activate and get used to their patient portal is extremely important. So,
right.
And many people are complaining about phones not being answered, prescription not being refilled, because we don't do those things through the phone. So it needs to be through the system, through the patient portal. Mm-hmm. And it's extremely user-friendly, and not using it is not a good option for anyone. So now we are going to have our guest coming soon. I don't believe Dr. Valencia signed in yet. So what I would like to do while we are waiting for him is, let's see, I'm going to open up. So you know how we did all the new stuff on the PowerPoint? So now I have to find them. Okay, so let's just get to the other day when we were trying to prep for this meeting. One of the things that I was saying is my experience in New York, how bad everything was, how crowded everything was, and how really not controlled everything was. So But from the employment standpoint, like when I see those crowded groups, and then I know the pandemic was big, you would expect, because we are having a very difficult time to find people, and then it's not just us, any other businesses around the country, they're always having difficulties to find new workers. Now, with the pandemic, so if you just stay home and if you don't go anywhere, so then the idea of pandemic gives you this perception of, well, nothing is happening outside of, nothing is happening in the cities, people are not getting together, and everyone is in the really in a different situation, so that like the streets are empty, this and that. And that's not the case. So like I can tell you, like just from what I saw in the last couple of times that I was in, once in Philly, once in New York, it was extremely crowded. So now, Sean, you actually prepped this article for us. So 4.4 million people, they quit their jobs in September. Now, we don't know why they did that, right? Because there are openings and no one is fired. So what's your take on this?
Yeah, well, the first time I even heard about this was actually on the radio in the car. And during like one of the commercials, they come out with, their national news and just headlines throughout the country. And that was kind of one of the highlights, that in September, it was a record, with the most, I don't know if it was necessarily quitting or a combination of people retiring, but kind of the both. But the fact that 4.4 million people did leave their job in the month of September was, a record for the country. And, as you had mentioned, it's not like things are shut down completely. I mean, people are still out and about. It's still crowded. You're still seeing, like you said, in the city, obviously, urban areas are going to have a lot of people interacting and, still out and about on the town. And, having 4.5 million people in a single month is just kind of makes you step back and think, how are these people able to do that? What is the reason? Are they finished seeking work? Are they just content on relying on some other sort of means?
Sure. So, Sean, what I would like to do is Dr. Valencia just join us. So, because he's in the office, and then because of the time restriction that we have, I'm going to actually go back to our topic.
Yeah, definitely.
I just saw him. So, Donna, you can join us at this point. Dr. Valencia, how are you doing?
Good. Yeah. Thanks for having me again. Second time around.
If I say you are my favorite primary care, it would be right, because you are actually my primary care, right?
That's correct. Yep.
Well, thank you for joining us. So what we would like to do with these events, have one of the providers to join us. And in many cases, we do need the clinical part of these issues that we are dealing with, but we are talking about clinical stuff. So of course, like not including the providers, it would not be the smartest thing for us. So we wanted to include all of our providers with different topics, so then we'll have more, hopefully we'll be able to get more people benefiting from these events. So first, welcome again. And what I would like you to do, if you don't mind, and Donna, and they know everyone, but still, if you can just briefly introduce yourself, and then we'll start the presentation.
Yeah, so again, my name is Dr. Carlo Valencia. I'm one of the primary care physicians at UMACO Clinic, board certified internal medicine, and I've been in practice for about 9 years, I believe. Yep. And again, thank you for having me again.
Thank you.
Hi, good afternoon, everyone. My name is Donna Gunkel. I'm the Director of Clinical Integration for United Medical ACO. So I am over all of the clinical programs that support our network of physicians.
Thank you, Donna. So we are going to discuss anxiety and depression. And before we bring this up, so pandemic actually did bring a difference. Actually, it put a different spin, in my opinion. So, and it's not just my opinion, but there are a lot of different articles and research that we see that pandemic actually really made everything a little bit worse than what it was and what it is today. Now, the crisis actually is on the not only for the elderly, but even for the population, youth population. And this is a real issue that we deal with. Mm-hmm. Now, Dr. Valencia, this is one of the ACO patients, and when we are actually looking at these, this patient with depression is not someone who only has depression. So this patient has there are two medication behavioral health related, and then but then if you see every other medication that they are dealing with 10, 11 medications. Mm-hmm. So, and there are even more medications here. So when someone is not dealing with the single issue, single problem, then the issue that we see is how do we actually single the depression out and then just treat depression, or how do you guys actually deal with this when the patients are in your exam room? Because you are not psychiatrists or psychologists, so sure. Yep. You're primary care. What is your process? And if you can just give us the background of the disease itself.
Sure. Yeah, I think it's a good topic because, again, like you said, we've been having increased number of cases of depression, anxiety, especially with the ongoing pandemic. But I think before we start going into the details, we probably need to discuss the definition of anxiety, depression, because they can sometimes coexist, but two different things. So we'll start with anxiety. Anxiety is mainly you have symptoms of excessive worrying. You can have feeling of nervousness, fear of certain situations. And in some cases, you can have some physical manifestations, heart palpitations, sometimes chest pain, excessive sweating. And for you to be diagnosed with generalized anxiety disorder, most of these symptoms should be occurring almost on a daily basis, and it should be affecting your social and occupational functioning, and it should be ongoing for the past 6 months. Again, that's based on the DSM criteria. That's the the book used by psychiatrists to diagnose and classify psychiatric symptoms. Depression, on the other hand, it involves mainly, with feeling of sadness, feeling of anhedonia, or feeling of you don't feel happy, you don't feel motivated, loss of concentration. In some cases, they can affect your sleeping. Appetite can also be affected, low energy. And again, in severe cases, patients may have some suicidal thoughts. And again, based on the DSM criteria, you should have most of these symptoms for at least 2 weeks. And again, you've mentioned it's a common disease. Sometimes patients may have mainly anxiety symptoms. Sometimes patients may have depression symptoms. But does anxiety cause the depression, or depression cause anxiety? It's hard to say. Again, sometimes when you're feeling anxious, you tend to isolate yourself, and being isolated can sometimes can lead to depressive symptoms. But again, like I mentioned earlier, some of the symptoms can coexist. Unfortunately, not a lot of people seek treatment for depression or for anxiety for a lot of reasons. I think sometimes patients see depression as a social stigma still, especially for men. I've had a lot of male patients who are still hesitant to discuss or seek treatment for their depression. And again, treatment is actually, there's a lot of treatment options we have out there. Psychotherapy is one of them, meaning seeing a psychiatrist, and medications. Fortunately, some of the medications we use for both depression and anxiety, we can use the same medications. And then obviously, exercise helps with depression, yoga, vitamin D supplementation, they said can also help with depression. And some patients use essential oils as well.
So with the pandemic, your patient population that you are dealing with, do you see more cases with depression and anxiety, or is it similar?
Yeah, again, like I've said earlier, we're seeing more cases of the depression, anxiety. In fact, there was a study done by CDC. They sent out like invitations or surveys to 800,000 adults across the U.S. And this was, I think, back in 2020, last year. And based on their findings, it was like an online survey done in August and done in December. They found out that patients have an increased self-reported anxiety and depression symptoms from August to December. So again, the pandemic definitely affects a lot of people. We've been seeing a lot of patients having more depression, more anxiety, different reasons, from being isolated, not being able to see family members, and again, I had this patient who was working in the hospital. She said it's just so depressing, and the point where she cannot function. The depression has been debilitating for her, so she had to take time off of work. So again, a lot of these things are from the ongoing pandemic.
And also there is other than the COVID-related stuff, there's a seasonal affective disorder, right? So how is this different than depression or anxiety?
Yeah, seasonal affective disorder, it's mainly a subset of it's a type of mood disorder. So you basically develop mood symptoms or depressive symptoms, which is seasonal in onset, and then they do remission every season. So sometimes you can develop the symptoms during the fall season, and then I think there is a corresponding symptom onset during summertime. I think the depression during the winter season is more common than the one during the summertime. And again, most of the symptoms are somewhat similar to depression. They can have excessive eating, decreased concentration. Possible cause of seasonal affective disorder, they said lack of sunlight alters your biological clock that regulates your mood, chemical imbalance as well. Again, vitamin D I mentioned earlier can also be a factor. And again, for a lot of patients with seasonal affective disorder, they usually go away after let's say after winter season or after summer season. Typically, treatment includes, again, same type of medications we use for depression, antidepressants, phototherapy, getting more sun exposure during winter season also helps with coping up with seasonal affective disorder. So it's basically just a subset of a mood disorder that's seasonal in nature, I would say.
So,
And I think, sorry.
Go ahead, Donna.
No, I was going to say, so a lot of times, people, you hear the winter blues and
Right.
people feel that they have that because it's like they get up, they go to work. Maybe it's
Sure.
barely light when they go to work. When they come out of work, it's dark. They tend to just want to go home and kind of hibernate. So again,
Right.
it's some of those same things that we're seeing where they are kind of isolated. They're not around people maybe as much. It's cold. And we wanted to bring that up today because as we enter the holiday season, sometimes we do see an increase in patients who have the seasonal depression, sometimes for those reasons, sometimes for other reasons, other losses they may have suffered around the holidays and things like that. So we just thought it was important to bring this up to make sure that patients feel comfortable in talking to their provider so that they can get the treatment that they need.
And again, it's important to point out that, it's not unusual to develop winter blues, but, for you to be diagnosed with seasonal affective disorder, you have to satisfy the conditions for the major depression disorder. So it's like a milder form of seasonal affective disorder, but in a lot of times patients will develop that. But for patients with seasonal affective disorder, you get that regular symptom onset every year, and again, some of these patients may need some treatment similar to patients with regular depression.
You know, when we're kind of preparing for this event, so depression always reminds me of this this show. I don't know if you guys remember this. This is where our not MD Tom Cruise, who was talking about depression and blaming people who are being treated for depression if they're taking medications and stuff. And I actually was watching this again last night just to see what we can actually bring out in this topic, because you just mentioned people are not able to bring up these types of issues easily.
Mm-hmm.
So they don't like the idea of being depressed, and they also don't like repeating that to other people. So, but we want our patients to be comfortable with their primary care. But what would be the regular setting? Because you're setting in your exam room, for example, so you're not really, it's not a therapy office, right? So in terms of getting to know the patient, and what's the process that you guys are going through to identify the real issue? With that one, I have another related question to that. As we are doing the case reviews, case conferences, one of the you know how I am with the numbers, with the statistics. So I always look at the possibility and probability of different things. I see like patients who's not controlling their A1C, they are usually, they also have depression. Patients with morbid obesity, they have depression. So these are so much related. But sometimes we're not maybe approaching the right issue or treating the right issue, or do patients not come out and tell you exactly what they are going through with those issues? Right.
So again, there's different, there's some different triggers for depression. You know, obviously if you have a lot of medical conditions, sometimes patients will feel depressed with their conditions. Social stressors, like if somebody dies in a family, or if there's something happens with let's say their marital life, any type of stressors can definitely cause you know, flare up of depressive symptoms. But again, in some cases, like again, like I mentioned earlier, men they tend to be more, I would say, they try to keep everything for themselves. That's why we usually do like a standardized screening questions, like a PHQ-9, just because again, if you don't ask them certain questions, they're not gonna volunteer those information. So unless you ask the right questions, you're not going to be able to pick up those patients with milder forms of depression.
And that is key. We do, you know, in all of our practices, look at doing the screenings at least on an annual basis, and then more frequently if they have, you know, some other life event, as Dr. Carlo mentioned. It is important, and sometimes that is the opportunity that maybe the patient's looking for, so they don't feel comfortable coming out with it. But if you ask the question, then it poses that, and you know, not every time, but hopefully, you know, it does lead them to feel comfortable and then to open up about the situation.
Right. And I think as you grow to know the patients, they tend to feel more comfortable with you. So you develop that rapport with the patient. I had this patient I saw, I think just recently, he was in the ER for weight loss, and they did a workup. They couldn't figure out what caused the weight loss. So when I saw him in the office, I asked him what the reason for the weight loss is. So he eventually admitted that he hasn't been eating, and he's been feeling depressed. So again, it's sometimes patients, they don't volunteer those information. They're not readily, they don't admit that they have some depressive symptoms in some cases.
You know, I don't want to push my own agenda, but one of the things that helps people with depression is adopting puppies or kittens, right? So they do actually, so this week, friend of mine, SPCA, they are bringing more animals from the tornado area, actually. So there will be more puppies and kittens be available for adoption. So if anyone is going through the depression, or you feel like you are lonely, you can always adopt one. But one of the things that I want to ask you, this issue with the youth population, it's more and more common. It becomes more and more common. Is that something related to the generation that we are going through, generational issue, or is it something that's just the time that we live in? Is it like true for everyone else, or is it just more for one group of population?
Again, that study was done by the CDC. They found it it was more younger patients who had symptoms of depression. I'm not quite sure what the reason is, but again, everybody's undergoing a lot of stress. Again, the pandemic has been tough for everybody. But again, like I mentioned earlier, there's a lot of things that might trigger depressive symptoms, stressors, a lack of resources, those types of things. But definitely the pandemic has caused more symptoms of depression and anxiety.
Right, because they weren't going to school. So again, kind of that isolation, they were going to classes online.
Yep.
So probably in the last year or two, that has led to more of that for children. Those kind of things, being away from friends, not having that normalcy. Sometimes it's also, and we know it's been a big issue that's been more publicized, is like bullying. That can be a reason. Sometimes family situations, loss of a parent or parents divorcing. There are a number of things that can, lead to that for children as well.
Dr. Valencia, do you anticipate a bigger, maybe, do you think this issue is going to get bigger right after maybe pandemic? So like I say right after pandemic, I don't know if we are going to ever have the right after pandemic, but do you see like maybe like a year from now, there will be more people who are impacted by this just because everyone is going through some difficult times these days?
Again, hard to say. Certain things might trigger depression. Again, hard to say if this is going to be, if we're going to be seeing more and more cases after the pandemic. But again, the pandemic itself is a stressor for a lot of people. So that's why we're seeing a lot of patients with more depression, anxiety symptoms. So it might, again, it might get better at some point once the pandemic has subsided. But again, it's really hard to say.
See. Now, lastly, we have from our behavioral health group, we have our social workers. We are in a transition, but we'll have more social workers. And we try to complete or complement what you guys are doing in the offices and then try to follow through with those patients. Do you get any feedback from the patients? Like, because when we call them, they may be already in some treatment and then they are not sharing that with the primary care. And then we find out when we are following up with those patients. Do you get any feedback from the patients related to what we are doing?
They do appreciate that. Again, as you're aware, it's been difficult finding psychiatric services here in Delaware. We have less psychiatrists available. So with when Jackie was available and with Stephanie, they were able to get some appointments for some of our other patients. So they do appreciate that. So it does help for some patients.
Well, I know you are in the office and you are seeing patients, and I do want to thank you for your time and participating for this. It's always good to have you guys as part of this. So then when our patients are watching this, that's more beneficial for them, and then they can also get a different message, hopefully, or they can understand how we are emphasizing what you are trying to do. And thank you for being with us, and hopefully we'll see you again in the next couple months.
Okay, thank you.
Thank you.
Okay, bye-bye.
Right. So Donna, okay, Donna is gone. All right, Sean is back. So
I'm back.
we can go back to our discussion. Well, it is kind of related to the depression issue. If you think about it, like just because I think we are going to see, in my opinion, there will be more people with depression. So what we were discussing earlier, 4.4 million people, they quit their jobs, right?
Yep.
This is going to have some impact later on in a negative way. So I think people are kind of like, maybe they're kind of lost. They don't know what they are doing these days, or they just want to do everything. Maybe they think that they're going through some other trouble. Like you see the alcoholic beverages sales is up. So what's
like you said, who knows? I mean, obviously there's a variety of factors obviously that come into play here, whether it's, when the initial pandemic hit and, 90% of almost everything, shut down is, maybe there's less opportunity for people to go out and spend their money. So it swayed more towards, say, alcohol beverages here. But like you said, also with this, depression and anxiety kind of looming with the pandemic, people try to find certain ways to cope. So say they're not taking, the medical route or seeking counseling, they're trying to self-medicate sometimes. There's so many different factors that could come into play here, but like you're saying, overall, with the jobs, the 4.4 million people quitting their jobs, we're seeing an increase in liquor spending. Now the restaurant, bar and restaurant scene also outperformed what was predicted. So people are spending more money, but now you're saying, obviously quitting your jobs, you're having less money come in. So, kind of what are they using as their means to get by? Is it a sustainable approach for these people, or will there be, more consequences down the line that maybe they're just not taking into consideration at the current time? So
this says that about 59 million people are receiving welfare. This is monthly, right? So this may be different for each state, but the other thing that I can add to this, more than 30% of Delaware population is on Medicaid, some type of Medicaid, and Medicaid is with the poverty level being lower than a certain level. So this, when you look at it from a different point, this may be even higher than what it is. People who really don't actually get it, or who's not able to get it,
right,
who don't have access. That number is the official number, but my guess is it's higher than that.
Mm-hmm.
But what we are seeing is that people are actually, like, as you said, like they're spending more money. They're drinking more. They quit their jobs. So it's almost like if there's something else is going to happen that we don't know.
If they know, I certainly hope they share with me sooner than later.
So you have
right? I'll make a few calls. No, yeah, but it's I guess concerning. I mean, are people living for the present a little too drastically and not thinking what's going to happen down the line, where they're just I'll cross that bridge when I get there type approach, or maybe they have to kind of reevaluate some lifestyle changes there, see what's more sustainable. But as you said there with the welfare, that article that I had included there just came out this past week, and it was some numbers that kind of make you take a step back. And I don't think people realize how many people rely on certain programs from the government. Whether it's our food stamp assistance. There's so many different ones where you don't have to necessarily fall into each category, but definitely an alarming factor just looming in the back of your mind, just the fact of the spending, and with the bullets mentioned on the other side, with inflation happening, the job loss, it's kind of all these things compiled together. Definitely something to think about.
It's the issue of, I'll tell you, like what I see is there are businesses who are looking for jobs, and there are people who are crying for jobs. And then there are people who are on the street, they're having way too much fun.
Yeah.
And it doesn't add up. Like when you look at all these things together, it just doesn't add up. So there's something wrong. Like if we are able to, it's not for the United States only. In our Turkey office, It's a smaller office, about a little over 50 people. And then Turkey economy is not even close to what we have here in terms of purchase power and others. And we are paying higher than the market there. And in that 50 people recently, 16 people left for other jobs in 1 year. So that's 35% of the total office. And 3 people, they quit because they got married. So in Turkey, actually, you get, you're being rewarded for being married, only if you're female though. So, and I'm like, I talk to my family, I'm like, look, I mean, if you guys are having this crisis, how come people can leave a job like this that pays so well, and then they're able to find something else, or they're able to maybe not find something else for a couple of months, and then they're okay with, being married and then just taking 3-4 months. So there's some accountability issue, and people are just going to expect more and more from, others and from the government. And this is why actually one of the things that we started, and then I tried to kind of tie this into the topics that we are discussing last week. Our book was Crucial Accountability, and then complementing that book, the execution, the discipline of getting things done. So as I'm actually going through what these books are talking about, and I'm looking at the current behavior of like whatever you want to call, there's a big gap. So this book becomes almost so irrelevant these days for many of the people, and that's kind of sad.
Yeah, as you mentioned even earlier, how you said, with the depression topic that we're mentioning, is it something that's generational, or is it kind of, as everyone experiencing something as a whole? But like this, you're saying this about getting things done, are people now kind of accustomed with all our technology where it's, they kind of want to do less and less, but get rewarded more and more? You kind of want stuff, you want the immediate gratification, as opposed to, putting in the necessary time, effort, to reach long-term goals. So again, does that relate to the increased spending, bar and restaurant, liquor sales, where it's like, are there people just looking for this immediate gratification in the current moment, as opposed to down the line, more sustainable?
I think what I see is there is definitely an accountability issue. So what I try to do is communicate. The communication is, okay, so we do certain things, we expect certain things, and you rely on people, and then time is important. Like, I'll give you an example. This week I had a meeting, you were part of it. So with the client, and the client manager was reminded about this meeting. And from our side, I was on that meeting, you, Don and Uncle, and Katie. So 4 people. We put time away for this, and then it's on our calendar. And waiting for 10 minutes, this is a Zoom meeting, and then finally we had to reach out, and then they're like, oh yeah, we weren't going to be able to make it, we forgot. So you didn't forget, right? Like you just choose to not remember. And then that's the issue that I see, the accountability issue. So now that person, what they cost is like 4 people 1 hour, and then 5 providers 1 hour. That's 9 hours of what information we were going to share. So this not remembering, not doing this, not doing that, it's just like those are excuses to me. Now, these books, the education that we got, the training that we get from our upbringings, from our families, that all gives us certain accountability and liability, and it has to be reliable. So, and I think when people are not doing that, they're not being given enough responsibility, and then they're not accountable for their responsibility. And then when they fail, and then when society is just responding to them in a different way, then they go to depression. Like some of them quit. Some of them, they blame you for not communicating, but you do communicate. You do tell them, look, this is not okay. The communication doesn't mean that you have to yell at someone. Communication means that, like, we tell them this is not okay, and let's not do this next time. So,
Right.
but I think this book would be very helpful for those who actually
agree.
want to pick up some technical stuff.
Yeah.
So that's what we have for today. Did you want to add anything?
Well, just on that last topic, I think sometimes people just need to be a little bit more conscious of obviously how their actions affect others. That sounds kind of cliche, but like you said, if one person who we were depending on for that meeting, like, you don't realize, like, time is very valuable. And I think it's kind of selfish to assume that you could waste other people's time and their effort, what they prepared for the certain meeting, and I think just overall, if you're just conscious of the impact that, like, even today, with our office team building activity we had, just walking around the office and seeing the different departments, you realize how everybody's, kind of like a clog in the clock, where we all come together to kind of help this a greater picture. And, if one particular spot is just lacking or, not working at its fullest, it really does have a much larger impact than what they may
that what you're describing actually on Good to Great, the book that we shared first week or 3 weeks ago, that explains that so well. So then it has to start working. In order to start working, department needs to communicate better, but you have to be able to trust the other side. So then it will start working. Otherwise, it's going to be it's going to have issues and it's not going to work. So,
right.
So our next event in 10 minutes with Dr. Erkan, our Bariatric Friday, we are going to discuss intermittent diet, fasting, whatever you would like to call, for patients who are going through the bariatric surgery or who may not have the morbid obesity, but they are having difficulties with the weight gain. The intermittent diet is what we are going to discuss with Dr. Erkan in 10 minutes. So, Jean, thank you for putting everything together and participating in this. And we'll be back, we won't be back next week or the following week because we are closed. So we'll be back next year, right?
Yes, you'll see us in January.
All right. Well, until next time, please stay safe and we'll see you guys soon. Bye-bye.
All right, thanks. Take care.